bringing science to life is important because it's not just about understanding the science, it's also about why that's important and what it means. So I think it's important because it's really knowing what that means to patients, to their families, to the healthcare professionals that treat them, to the pharmaceutical companies as well, to the actual wider field. So I think it's more than just understanding the science. I think it's really understanding the why that's important and being able to communicate that. And it's not just being able to communicate it. I think it's all about communicating it in a way that is easy to understand, that it's relevant to the different audiences. You know, you might want to be communicating at different levels to different audiences. But I think it's helping people to understand why that particular drug or that particular disease is important to them, and what that's going to mean to them in what they're doing in their lives. I think the drug science may be coming. It definitely is. It's definitely evolving. There are definitely some fantastic new approaches to medicines that we have at the moment, and I think the challenge there is being able to explain those. I think it's not necessarily simplistic. Some of the ways that drugs work can be very complicated, involving many different systems. So I think there's a bit of a challenge there in being able to explain that in a way that's, again, easy to understand and what it means. It's actually bringing out why it's important. So, for example, one of the drugs we work with has the only difference is somebody has tweaked a linker in a molecule, and that doesn't mean anything, you know, in a sense. What does that? But it's being able to translate what that means in clinical practice. So, how does it translate into benefits? What does it mean? What makes it different? How can you use that to differentiate? I think another example of the complexity might be the oncology field, where there are so many drugs with so many different mechanisms of action, and each manufacturer might be saying this is the way to treat it. This is what's important, and it's being able to distill that down to make your product stand out. I think that makes it a challenge at the moment, to not only to explain how the drug works, but to differentiate and make it stand out. Science is definitely getting more complex. There have been some great innovations, and I definitely think the innovations will continue. So that is going to be a challenge, but it also means the field's more noisy. There's lots of things vying for your attention. So I think it's quite hard to have something that's cut through that can stand out. I think it makes it harder for something to stand out. You don't necessarily get those kind of huge blockbusters drugs that you used to get. But I think one of the key thing, the thing that's changed, and the thing that will continue changing, it's the way we access information. So if you think back 5 or 10 years, you would maybe sit and have a chat with someone. If you're a sales rep, you might be reading something, you might be at a congress. But the way we access information has changed massively. You think of the digital influence that we've had. You know, phones used to be just a way of ringing somebody just to have a chat, whereas now we access information on our phones. We access information differently. Before, people used to have that used to be able to sit down and go for a 2-hour lecture and not think anything of it, whereas now we all access information in a very much more bite-sized way. There is a lot more clamoring for our attention. Even if you go on a journal website, for example, at the moment, there's always a banner there trying to catch your attention, saying, why don't you come and look at this? Why don't you go to this talk? So I think that the way that we are accessing information has been the biggest change, and I think that's going to continue to evolve, and that's something that we need to work with if we're really bringing science to life. It's how do we work within these new communication channels and the way that people want to access their information. I think it's very different now. I think, you know, even just going on the news is no longer waiting for your daily newspaper. We can access news whenever we want, wherever we want, however we want. Some people listen to it, some people just scan through the headlines on their phone, and it's the same. I think it's the same. I don't think it's any different in healthcare communications. We just have to move with that and to help people to access the information in the way that's right for them. So I think that's one of the biggest challenges we have.